any downsides? What are the complications? What are the risks that people need to know about for Coolsculpting treatment?
So very minimal. Most of the things are short term. You get a little bit of redness after the treatment when you take the applicator off. When you take the applicator off, you get left with the tissue is obviously frozen, so we massage it to try and get rid of any of those fat cells that haven't quite shattered.
I tell people it feels like a steak you took out of the freezer half an hour ago.
Like a chicken.
Oh, yeah.
It does like it's kind of crystallized like that. And
so I say,
don't touch me.
It's a little bit like someone massaging your feet when you've got pins and needles. So it's
it's not nice.
It's not nice. No one likes it. But when you just think about the results, and I tend to just like distract you by talking.
Yes.
And it lasts 1 minute.
It's 1 minute.
Yeah.
1 minute.
Well, 2 minutes, isn't it?
No, 1 minute for the really big bit, and then the other minute is
So a little bit of redness, a bit of localized swelling, and that can last for a week or so afterwards. And obviously you can't use the anti-inflammatories because you need the inflammation in the body to try and excrete those fat cells. It's a bit of redness, a bit of tenderness is totally normal, and like I said, a bit of swelling. So if it's a tummy, your jeans might feel a bit tight for a little while, a little bit uncomfortable, so say wear comfortable clothing. And then then it's just like the more rare side effects that we've never had any issues with, but obviously have reported in the 8+ million treatments that have occurred worldwide. So there's one, and it's called Paradoxical Hyperplasia. Where basically it's a bit of a phenomenon. They don't really know why it happens, but when the fat cells are frozen rather than shrinking, that they enlarge. Extremely rare. Apparently there's a small number of men, middle-aged men in America that has happened to, but they don't really know why, and it has to be treated with liposuction to then remove.
Unfortunately, we have a surgeon on site, me, so I would do the liposuction.
I was like, luckily we've got surgeons.
And the company foots the bill, I gather.
Yeah.
We've never had to use that, but if you report it to Allergan, who manufacture Coolsculpting, they'll say, yeah, it's a fair cop, just prove that that was the treatment that you had, which we can do, and they will then pay for your liposuction, and I will do it.
Yeah.
But we've never had to do it, and I hope we never do.
And then there's the more rare ones, the risk of frostbite injury. The machine has so much technology in it to detect the temperature of the skin, so it's very, very unlikely that that's going to happen. And that's why we're always really careful. We'd never reapply it if it pops off sort of halfway. And then you've got...
We've got about 20 seconds before Instagram kicks us off, so just warning you.
Pigmentation is possible in darker skin types, but can be treated. And yeah, that's it.
Yeah, amazing, cool. Jenna, this has been brilliant. I have loved this. I've learned so much as well. Really, really fantastic. Thank you so much. And thank you everyone for tuning in.
Jenna, you're amazing.
Bye-bye.
Bye, darling.
Bye.